one of the most dangerous and most responsible viruses for illnesses in human beings.
And what are the potential complications of the RSV virus, and how can vaccination help?
Once it goes down to the lung, it will lead to bronchospasm, which means tightening of the airway, excessive mucus production, and sometimes complete obstruction of the airway. And the problem is, if you get infected once, naturally, it doesn't give you immunity. So you could be infected again and again. And that's why we were really looking forward to have a vaccine.
Welcome to a new episode of KT Talks. Today we're joined by Dr. Hossam Al Tatari, consultant pediatrician in the Heart Medical Center in Al-Ain, UAE, American board certified in general pediatrics and pediatrics infectious disease. He is also a professor of pediatrics from University of Western Ontario, Canada. Doctor, thank you so much for being with us here today.
Pleasure to be with you. Thank you.
Thank you for having us. If you could please tell us, what is the respiratory syncytial virus and how does it affect the respiratory system?
Yeah. So the respiratory syncytial virus, also known as RSV, is one of the most common viruses that affects human beings at all age groups. It's one of those respiratory viruses that gives you respiratory infections, and we'll talk more about the details of those infections. It was first discovered in 1956, and ever since there is mounting evidence that it's one of the most dangerous and most responsible viruses for illnesses in human beings.
Can you please explain what are the typical symptoms of the RSV infection and how do they differ between infants, children, and adults?
Yeah, so the symptoms vary. It could be very mild, just like a common cold, a little bit of sneezing and runny nose, and it could go all the way to severe respiratory distress, cough, difficulty in breathing, tightness of the chest, which sometimes leads to complete respiratory failure. So it really varies. Now, we know that symptoms are more severe in the extreme age groups, so that's the first 2 years of life, and those who are older than 60, but also patients with chronic illnesses, those who are immunodeficient, those who have severe lung disease like cystic fibrosis, they are at risk of having severe disease just like little infants and old people.
And what are the potential complications of the RSV virus, and how can vaccination help?
So the RSV typically starts in the nose, and from there it finds its way down to the lung. So it will give you upper respiratory symptoms in the form of sneezing, congestion of the nose, runny nose. But then once it goes down to the lung, it will lead to bronchospasm, which means tightening of the airway, excessive mucus production, and sometimes complete obstruction of the airway. That may lead to what we call respiratory failure that will require lots of support, many times even in the ICU. It's kind of interesting to know that children younger than 2 are definitely going to have at least one infection in their lifespan.
Wow.
And the problem is, if you get infected once, naturally, it doesn't give you immunity. So you could be infected again and again.
Wow.
And that's why we were really looking forward to have a vaccine. Okay. So right now, we have 2 options to protect ourselves. We have the vaccines, which could be given to the pregnant woman in their last trimester to protect the baby in their first 6 months of life. And this is the most dangerous part of their life. And the same vaccine can be given to elderly after the age of 60. So this is one form of protection. The other form of protection, we have what we call monoclonal antibodies. So when we give the vaccine, we wait for the human body to produce antibodies. Now, the alternative is to give them those antibodies ready-made.
Okay.
Now, this is another option. There are a couple of them out there, but they are harder to administer, far more expensive. So the hope actually is still there for the vaccine.
Okay, very interesting. I think pregnant women, this is very interesting for them. I think they would definitely want to know this to avoid it. So if you could tell us, what are the current advancements of the RSV virus?
RSV behavior has changed over time. So in the beginning, it was recognized as a disease of young children only. And with the passage of time, we started to recognize that actually it infects everybody. And there has been change in the epidemiology of RSV after COVID. So, for example, in the past, it used to be a winter disease. We used to see it between October and March. Now we see it throughout the year. Okay. Yes, the peak is still during winter, but we do see significant number of cases during summertime also. So that's one change. The other change, as I mentioned, it's not a disease of young infants anymore. It infects everybody. And we started to see severe cases even in children beyond the first year of life, which is kind of new. So in the past, children around the age of 5 or 6 would have a very simple common cold, and it would go unrecognized. Nowadays, they're really getting sick with flu-like illness. Many of them gets even admitted to the hospital and gets admitted to the intensive care unit. So indeed, the virus is changing its aggressivity. It's becoming more widely spread, and it's affecting all age groups.
Wow, that's something.
That's interesting.
That's
We
very,
have to
very
keep an eye.
interesting. If you could tell us the current advancements of the RSV vaccine development.
Yeah. So despite the fact that we know this virus since 1956, there is no effective treatment for it. So the treatment is just supportive. So even when we admit them to the intensive care unit, we try to help them with suctioning the mucus. We try to give them bronchodilators. Many times they don't even work. We try to give them oxygen. When they are in respiratory failure, we put them in ventilators. But there is no very potent antiviral that can kill the virus. So the hope is always to prevent it right from the beginning. And the best thing for prevention is always vaccines. So as I mentioned, there are a couple of vaccines out there. At this time, we give them to pregnant women so that they pass the immunity to their babies, and that immunity is going to protect the baby for 6 to 9 months. And we give them to elderly people. We're still hoping that there will be a vaccine that we could administer to children right after birth, like any other vaccine, that will give them protection maybe for the first 2 to 5 years.
Oh, wow.
It's coming. It's coming very soon.
Okay, and can we know the current, like the accuracy of the vaccine? Like how accurate is it? Do we have?
The vaccine actually is pretty new, but it has proven through clinical trials to be very safe and very effective. It reduces hospital admissions by close to 80%.
Wow, okay.
This is kind of interesting when you know that 1 out of 50 children actually will be admitted to the hospital at any given time during the first 2 years of life. 1 out of 5 children will be sick enough to go and see their doctor. So the burden of this disease is quite significant.
Can you please discuss the public health implications of the widespread RSV vaccination?
So let me take you to the life of physicians, okay? So we have something called RSV season. Which is typically October to March. And as I mentioned before, it started to become longer and longer. So why do we call it RSV season? Because we get extremely busy in the office with sick patients coming all the time. We get extremely busy in the hospitals. I wouldn't exaggerate if I say that at certain times, 50% of the beds would be occupied with babies with RSV. And it's a huge burden on the parents who will have to miss work. It's a huge burden on us taking care of those children, knowing that there is no antiviral. We're just trying to support them as they go through the illness. It's a huge burden in the medical system because we have to isolate them from each other. We don't want the virus to spread within the hospital. So it's really a huge burden in the medical system. It kind of sucks our capabilities during the season. So once this vaccine is available, I think we're going to have more empty spots in the clinics. We're going to have more empty beds in the hospitals. We will decrease the cost of medical care for the general public, which we can allocate in some other areas.
Wow, so this virus is really a work.
It is a real burden. It is a real burden on the medical system.
Wow. I was going to ask you how might it affect the healthcare system, but I think you already covered that. But if you would like to tell us how would it affect the healthcare system, and especially during peak seasons.
Yeah, so just try to imagine that, for example, let's say in a typical season, you admit 100 patients per week, and we got everybody vaccinated, and instead of admitting 100, you're admitting 20. Just try to imagine that.
Wow.
So you're emptying 80% of your beds, you're emptying 80% of your time, so you can allocate it to other patients and provide them with care.
I actually did not know this. This is very interesting information. Thank you, doctor. Do you have any last comments or something additional you would like to tell the audience or people listening?
Yeah. Prevention is better than cure. And to boost the immunity of your children, I always advise to do the following. Make sure that you breastfeed your baby exclusively for at least the first 6 months, because this is proven to protect children against respiratory and GI infections, including RSV. Make sure that you provide them with healthy food. Stay away from snacks and junk food as much as you can as they grow up. Take them away from screens, because there is strong evidence that iPhone and iPads actually do decrease the immunity of our children, and that's why the current generation is getting more sick than the previous generation. Make sure that they sleep early. All of those things will boost their immunity. And whenever there is a vaccine available that is known to be effective, that is known to be safe, please administer it to yourself and to your kids. And I wish you a very safe coming winter.
Thank you so much, doctor. I think these advices should be implemented on everyone, not only children.
Absolutely.
Thank you so much, doctor, for your time today.
It's my pleasure. Thank you for having me.
Thank you so much.